For more on this, we can speak to Maina Vorley, who's with the Nairobi office of the CARE International Humanitarian Agency. CARE is assisting with aid in Sudan right now. Thanks so much for your time, Kate. Can you describe for us the situation in Sudan? What are you hearing from your team who are working on the ground there?
Thank you very much. So what we're hearing is that the current ceasefire, it was a welcome reprieve for Sudanese citizens, but we are receiving reports from our teams that the fighting is continuing in parts of Sudan despite a 72-hour ceasefire largely holding. We're also hearing that our people are trapped in their own homes, staff and our families in places like Khartoum and Yala. They are trapped in their homes, low on food, and even amid water power cuts. Wound people can't access hospitals. As you reported earlier, we're also seeing we're hearing Sudanese making their own evacuation plans, headed towards the border to Chad, where we as CARE in Chad are also responding and working with stakeholders there to receive refugees from Sudan.
In terms of the assistance that you are providing, what are your priorities right now?
So our priority, as I mentioned earlier, of course, is the duty of care to our staff. The safety and security of our staff really is a top priority for us, and we are relieved that we're able to account for our staff. Our commitment to the people of Sudan remains intact, and our priorities to the Sudanese people. We are continuing our life-saving work across those states that I mentioned, working together with our partners. And even as the fighting has continued, our partners continue to provide essential and life-saving services. We've reopened our offices. We are responding in several sectors, including water, health services, and nutrition services. And on the Chad side, CARE is working with UNHCR and other actors to facilitate the reception and the registration of refugees flowing into Chad.
Maina Vorley, Director of the CARE office in Nairobi, thank you so much for your time today.